Hi, Dr. Don Hayes, DC here for EndFlame. What's EndFlame? Well, EndFlame is a very simple, patient-administered, at-home fingerstick blood test that all chiropractors can use that's supported in science. EndFlame determines the existence and extent of a fatty acid deficiency that correlates very closely with the levels of various inflammatory cytokines in the blood that develop from a variety of causes, including, of course, neck and back trauma, but also toxins and pathogens. Now, research on testing blood proves it's the gold standard for diagnosis because why? It never lies. But along with that is also the fact that blood measuring allows doctors to practice by the philosophy, you can't control what you can't measure. For instance, cardiologists use a C-reactive protein blood test to measure for cardiovascular inflammation to actually decide to prescribe a statin. Chiropractors can now use the EndFlame blood test to correlate a fatty acid deficiency with acute and chronic muscle and joint inflammation. A correlate means that a change in one thing results in a similar change in another thing. Now, since we virtually deal with acute and chronic muscle and joint inflammation with every patient, we now have a research-based blood test that measures fatty acid deficiency that the science shows clearly correlates with both acute and chronic inflammation. And then we can use those blood test findings to prescribe lifestyle changes and pro-resolving nutritional supplements to support the shutting down of the inflammatory response that can return injured and damaged tissue to resolution and pre-injury status. Now, before I share more about the science of the EndFlame test, hey, let's talk about you. I mean, you got this video because you were selected and you agreed to conduct the EndFlame fingerstick test on yourself. Now, the process is for you to conduct the test, send it to the lab, and when the results come back, schedule and receive a 30-minute consultation with me. Now, I want to make real clear here that the EndFlame consultation that you're going to get will not include any medical advice, a diagnosis, or any kind of treatment, but instead is purely for educational purposes only. Now, the strength of the EndFlame test is really in the science. I mean, using the omega-3 index and the omega-6 to omega-3 ratio as a diagnostic tool in your practice is supported in science with more than 200 different studies and over 100 different peer-reviewed journals in collaboration with top institutions such as JAMA and Harvard and Stanford universities. Now, even though these type of top medical institutions use the omega-3 test, guess what? Most chiropractors do not. Why? Because of the expense. I mean, this test used to cost physicians about $300, which was really no big deal if you have insurance reimbursement. But since we don't, it won't work for us. But today, the EndFlame test costs chiropractors only $40. And come on, that includes the postage paid envelope inside the kit for patients to send their sample back to the lab. Now, at the $40 price point, chiropractors can use the EndFlame test on every patient by building that cost into their exam fee. Now, most do charge a separate office visit fee to go over the results, and along with the supplement fee, they earn a comfortable return on investment. And chiropractors typically agree that a few $1,000s each month from the tests and supplements helps cash flow, but it's the new patient referral revenue that EndFlame attracts that really makes the difference. Now that you know that EndFlame is compliant because it's an at-home fingerstick blood test, it's affordable for patients, it's profitable for you, all that's really left is why should you use the test on every patient? And guess what? That brings me back to the science. You see, the research behind EndFlame occurred because of the discovery by one scientist, Dr. Charles Sirhan. Sirhan is a professor at Harvard Medical School and director of experimental therapeutics at Harvard's Brigham Hospital. He's authored more than 400 scientific publications, written 5 books, and he's been awarded more than 200 patents, one for this product. Now, he sits on the scientific advisory board for the Inflammation Research Foundation. It's a nonprofit organization that researches the use of nutritional approaches to reduce inflammation. Sirhan is one of the world's leaders in inflammatory biochemistry, and he's the actual person who discovered the role omega-3s have in the resolution of inflammation. Now, he named his newly discovered molecules that he patented resolvins. Now, Sirhan's research on resolvins is cited in medical pathology textbooks. One of the most popular is the one you see here on the screen, Pathologic Basis of Disease by Robbins and Cotran. Now, figure 2-21 in the 7th edition provides a diagram that you see on the screen entitled Outcomes of Acute Inflammation. Now, when you look at the injured tissue shown at the top left, the caption reads that the inflammation occurred from either a trauma, infection, or a toxin. Now, I want you to remember this as you look at your own results and results of patients later. Sirhan is basically saying that muscle and joint pain and inflammation, it may be caused from things other than trauma. But hey, whatever the cause, the inflammation triggers the immune system to respond. Now, take another look at that damaged tissue at the top left of the chart again. You see the blue dots there? The blue dots around that inflamed tissue, those are resolvin molecules, hey, that no one knew even existed until Dr. Sirhan discovered them. Resolvins, if they're present, will shut down the acute inflammatory response naturally, allowing the injured tissue shown on the top left to move directly to the figure shown on the top right, where it's called resolution or pre-injury status. Now, as a reminder, subacute inflammation is that period of time between acute and chronic inflammation that typically extends from anywhere from 2 to 6 weeks. Now, that's the window that you and I have as practitioners to use the EndFlame blood test. You see, the EndFlame results will tell us if the patient has an omega-3 deficiency, and if they do, it will enable us to prescribe high-dose pro-resolution supplements to shut down the acute stage and take the injury to complete resolution. Now, resolvins are made on demand at the moment the immune system is triggered, but and only if the patient has an omega-3 index above 8%. The 8% represents how much of the fatty acids in that patient's blood are actually EPA and DHA, because only EPA and DHA make resolvins. Now, Sirhan's research shows that the level must be above 8%, but is better at 12%. He says a patient can actually build up what he calls a resolvin reserve, or stockpile a resolvin potential in case of further inflammatory issues by increasing their omega-3 index, let's say from 8% to 12%. So this reserve becomes a way to protect yourself against future toxins, future pathogens, and certainly future traumatic injuries. So let's go back to the graph. Let's say the patient doesn't have at least 8% EPA and DHA in their blood, and most don't. So instead of going to the top right figure, they'll go from the top left to the bottom left figure. And Sirhan calls this condition failed resolution. You see, if you don't have the EPA and DHA in the blood to take the injury to resolution, the body goes into plan B because it just will not allow the inflammation to further damage tissues. In that bottom left figure that you see, the acute injury and the inflammation starts to get walled off with a fibrotic scar that becomes the start of chronic inflammation. And by the way, at this early stage, the walled off injury is asymptomatic. So both patients and doctors think, hey, things are getting better here, we don't hurt, when in fact they're getting worse. Now, the Inflammation Research Foundation says that many practitioners that treat muscle and joint injuries, they think because patients are pain-free at this stage, they're at resolution, when in fact, they've fallen into fibrosis and chronic inflammation. You see, the only way to know for sure, says the IRF, is to test, not guess. Now, of course, as patients continue to remain EPA and DHA deficient, their chronic inflammation, of course, gets worse. And then they move from the bottom left diagram to the bottom right diagram, where the condition now becomes completely fibrotic with a loss of function. And at this stage, guess what? The injury usually becomes symptomatic and gets a diagnosis of, hey, say, osteoarthritis if it originated in a joint. So the only way to be sure an adequate reservoir of omega-3s are present for you in your blood, on your blood test, in your bloodstream, is to test yourself using EndFlame. Both the omega-3 index and the omega-6 to omega-3 ratio need to be in their normal ranges to ensure an adequate level of EPA and DHA is available to make resolvins. So we got to do that to prevent you in case you have some kind of an inflammation from anything, injury, toxin, or pathogen. So be sure and take your test. Now, in closing, by now or very soon, you'll have your own EndFlame test kit. Be sure to read the instructions, take the test as soon as possible, and mail it to the lab. I'll receive your results in 7 to 10 days, and you'll be contacted by my associate at Meyer DC to set up your consultation. Practitioners often ask the Meyer rep to just send their results, but hey, you signed a HIPAA form, which obligates me to go over your results personally. The last group of 25 healthy doctors I consulted found over 80% of them to have an omega-3 deficiency or an omega-6 to omega-3 imbalance or both. But I'm happy to report that all of them were able to get both results back into the normal range within 90 days by following the dosage chart that I gave them and taking a therapeutic dose of Greens First omega-3 850s and Greens First Pro polyphenols. Now, for ourselves, our family, and our patients, we must always maintain a robust reservoir of resolvin potential to stop any inflammatory response that may occur from injury, toxins, or pathogens. I want to caution you and make sure that you watch my next EndFlame video training on my YouTube channel, where I'll provide the easy implementation steps to add the EndFlame program into your practice. You see, when it comes to your health, the health of your family, loved ones, and patients, remember, don't guess when you can test. This is Dr. Don Hayes, DC, saying, hey, thanks so much for watching. I'll see you next time. Bye for now.